Hi, I'm Tiffany Hickman, and I'm going to be discussing exercise and menopause to improve symptoms and quality of life. Clinical question is, in menopausal women, how does 30 to 60 minutes of moderate intensity exercise 3 to 4 days a week, compared to those that exercise less or not at all, affect menopause symptoms and perception of quality of life? This is an important question because it's a problem that affects all women, and the transition through menopause lasts approximately 2 to 8 years in 95% of women. The severity of the symptoms range from mild to severe in these women and can significantly affect the quality of life. And here in the recent years, hormone replacement therapy is actually no longer recommended for routine use as a treatment for menopausal symptoms because a large clinical trial in 2002 discovered that invasive breast cancer can be linked to hormone replacement therapy. So now we need to find a lower risk intervention to help these women through the menopausal transition. The literature I reviewed were 2 random control trials, 2 causal comparative trials, and 1 random experimental trial that had no control. All studies but 1 provided statistically significant evidence to support that exercise improves menopausal symptoms and quality of life. The 1 study that did not reach statistically significant evidence to support exercise improving menopause symptoms actually did show that exercise improves sleep in these women, and actually the BMI in the experiment group decreased significantly, and in the control group the BMI increased significantly. So there were still improvements seen, but there was a significant improvement from baseline in both the experiment and control group, so that made it difficult to prove that the exercise was the reason for the improvement in that experiment group. One of the reasons for that could be that hormone replacement therapy was actually allowed to be initiated in the control group during the study, so that could have caused the improvement in symptoms in that group. So all the other studies did show significant improvement in the menopause symptoms and quality of life in these women that were exercising. We do need more research to provide the exact recommendations for quantity and length of the workouts to provide the optimal benefit. And we know that exercise promotes health by improving hypertension, obesity, reducing stress, and the risk for coronary artery disease. So it's recommending exercise to menopausal women who are cleared by their primary care provider has a minimal risk, and it's likely to improve their overall health, not only their menopausal symptoms, so it's a good thing. And the intervention that I propose is for primary care providers to educate this population on the benefits of 60-minute moderate intensity workout regimen at least 3 to 4 times a week. The healthcare providers should encourage menopausal women to incorporate this activity in their weekly routines habitually, so we need to make sure they're doing it on a regular basis. Supervised programs are actually really good. They could be better than just having the woman go and work out on her own, because supervised workouts reduce the risk for injury, and also that could increase the compliance to get the women back into the routine of actually working out. And exercise should be prescribed as a primary intervention for improving menopause symptoms before hormone replacement therapy is considered, because of the minimal risk involved with it. And the provider should assess the menopause symptoms at baseline, and then also every visit after, to make sure that their menopause symptoms are improving. And there are several tools out there to measure menopause symptoms. The one that was used frequently in these studies was the Kupperman Menopausal Index, and it's been validated and can be easily accessed. And the environment that this can be implemented in is at any primary care office, and also more programs need to be started in healthcare and workout facilities to target this population. I know where I go here in Lexington at HealthWorks, there are Forever Fit and Silver Sneakers group classes that target the older population and could be useful for menopausal women, especially when they're just getting back into the routine of working out, because it's a little, it's not as high of a level of intensity. So providers should learn what classes like that are available in their community, and educate their patients on those and encourage them to attend it. And that concludes my presentation. The next slide has my references. And that's it. Thank you.